Right. So what I thought would be really useful in this session is you've taken part in a clinical trial, haven't you?
I'm part of a clinical trial at the moment.
Right. Okay. And it's at Leicester and it's under Alex's supervision. Is that right?
That's correct, yeah, and Chike, yeah.
Ranchike, right. I can't remember. Is it an IgA nephropathy clinical trial or is it a general?
It's IgA nephropathy.
Nephropathy. So it's one, might be one of the trials that Chike was talking to us about this morning.
Quite possibly, yes.
Okay. So what I think that you are invaluable in this meeting is to tell people, to share with people why you want to do a clinical trial and what happens when a patient is doing a clinical trial. And if you'd like to share that with us, that'd be great. Thank you.
Well, obviously, I was diagnosed just over a year ago now, well, coming on for 2 years, and it was quite a shock because it would always be a thing for most people. Almost immediately, I was offered the opportunity for the trial, and it sort of made a lot of sense and answered a lot of questions for me. Simple reason being, it's sort of I was completely in the dark as what was wrong with me, and it also gave an opportunity to sort of to help others as well. Obviously, it's not the trial I'm on's an open drug, so we know what we're taking. And it gave me that opportunity that if it didn't necessarily work for me, it may work for somebody else as well. And it may give somebody else a better chance. So, it sort of just made sense to me to offer that opportunity. Yeah. The actual trial itself is relatively straightforward, to be fair. Hardest part for me is time. It's quite a commitment, but it's a commitment to your own health as well. So I have to take holiday days every time I visit the clinic. It is quite a commitment to make, but it's a relatively small one in the grand scheme of things. The trial itself, as I say, you turn up, blood tests, blood pressure and various tests done on you. But it's all straightforward. Everybody's fantastic at the clinic in Leicester and at the General. It's friendly, it's easy to find, and it's a good location for me. I mean, I live in Leicester, so it's relatively straightforward for me.
So when you say about the time commitment, what sort of time commitment are you looking at?
At the moment, obviously, I'm quite some distance into the trial now, so every 12 weeks I have to visit the General. For me, through work, etc., it means I have to take a day off holiday. Yeah. At the beginning, it was a little bit more intense. Obviously, we're making more visits, and there's various other tests I have to have done at the LRI in Leicester and the Glenfield. So, as I say, it's quite a commitment in time for me over the last about 18 months now, in terms of holidays I've had to take to be able to go and have the tests I need. But at the end of the day, I'd have had to have had those tests quite probably anyway, because of the illness.
So do you know how long the trial is? Have you been told how long that trial is?
Off the top of my head, I believe it's March 23 when we finish.
Right.
We started. I started on the trial. I think it was January, February of last year.
Yeah.
So everything for me happened during obviously the lockdown and whatnot, and we've gone through quite a bit together during that time.
Right. Okay. I know. Have you been well during the time that you've been on a trial?
Yes, I had a couple of scares with COVID, but they were false. But other than that, to be fair, the drug I take and has been quite successful in the treatment I've received.
Oh, right. Okay. So you think you might have got some sort of benefit as well as giving something back?
Very, very much so. My protein spill is negligible. It's back into normal readings. It's been pretty successful. Yeah, very successful.
Right. Okay. I mean, this is not a commitment. Do you think, on the experience you've had, do you think you'd do it again?
Yes, without a doubt. I won't think twice.
Yeah.
Yeah, definitely. The other side to it is the knowledge that you gain through being on the trial.
Right.
Not just with what's wrong with me, not just with the IgA, but I now know pretty much everything about myself. Um, you're tested for so many different things as part of the trial that, yeah, I've got far better knowledge of my body than I would ever have had I not been on the trial, I believe.
Yeah, because you've got somebody who'll answer your questions as you turn up.
Answer the questions, do the tests. I mean, as I say, I know literally everything now about myself and what I need to do to get fitter as well.
Right.
It's yeah, there's a lot of things that you learn that you would never have an opportunity to be honest.
Right. Okay. Oh, that's really helpful to tell us that information, actually. Just to swap over just for a little bit, because Dipper has joined us. But stay there, Jason. We're
Yeah, no
not
problem.
finished with you yet.
Yeah, no worries.
That'd be really helpful. So thank you very much again. Well, actually, thank you very much, Jason and Dipper, for giving us some time on a Saturday to share this information with us, because you are the two people on the group that know about, that do know about actually, turning up and doing a clinical trial.
Yeah, absolutely.
Yeah. So did you? So you got IgA nephropathy? You different kidney disease? Just out of interest.
So I've had a transplant now. So in 2020. So when COVID kicked in. So since then, obviously pre-transplant, I was involved in another trial, but now post COVID, I'm involved in the Protect V trial, which is about enhancing the spike protein or protecting kidney people with COVID. I've been on the trial now for 3 months, so it's a 6-month trial, and it's to so I take a nasal spray which is called Protect V. Nothing really major. I take it once in the morning and once at night. Really simple. Pre going on the trial, very similar to Jason. Clinic visit, taking your blood. Quite a lot of blood, 12 bottles to be fair.
Right.
But to what Jason said, yes, 12 bottles, but it gives those 12 bottles give you so much information about your body, your bloods, and again where your kidney functionality is around that as well. And again, for the first month I was going in to take regular visits. The clinic is absolutely amazing. Again, Glenfield's only a half an hour run for me, so really straight to the point. But now I obviously, because again, in your working while, I opted to do follow-up questionnaires through email. So dead easy, an email comes to you every couple of weeks. You just respond to see how you are, any changes to you, how you're feeling. And it's really easy. I'd recommend it, very much like Jason said earlier on. If I was on another trial, I would definitely do it, because it's about helping others, further down the line. And there's no impact to the way that because I have a flexible job. You go to the clinic, Alex and the team, make a cup of coffee, what should be a 10-minute visit ends up being an hour. So you become a part of the family. So really, really easy, recommend it, and no real issues, to be fair.
Right. So that sounds like the negative is you're giving quite a lot of blood, but you think they may have given it anyway. But the positive is you've got a captive audience. If you're feeling a bit sort of ropey, and it's still reasonable. So people, if you get somebody to ask questions about.
Yeah, absolutely. And not just, it's just not at that, it's just not while you're there, the text, you can text them at any given time, phone them. They're accessible at all given time, so it's not like it's a 9 to 5 or a 9 to 4 clinic. If you're feeling ropey at any given time and you just want to check in, just send a text message and they'll tell you what steps and precautions to take just to make you feel better. And if you still carry on feeling like that, they'll call you into the clinic for just further checks. So the follow-up and the response from the team is is brilliant. The feedback that you get is of excellence, just because you get a really good understanding of your disease or where you are from a health perspective, but also the long-term plan around what happens. And in any trial, there are pros and cons, and they make you aware of those pros and cons before you sign up. So, and the beauty about being in a trial is if you're uncomfortable at any given time, you're able to withdraw from that as well. So you have that choice as well.
Okay, so if you, so I'll get back to Jason. Have you ever been asked to do anything you're uncomfortable with?
No, the information I received every time you go is you've got all the knowledge you need, and you can say no. If you do feel uncomfortable, that's an option. You can say no, not doing that. But for me personally, with the knowledge I've been given, and obviously now over the time I've been on the trial, no, it's everything's been quite positive for me. But as I say, I'm more than happy with the fact that I've got that option to say, actually, no, that's enough. I'm not going to carry on, or I'm not willing to do these things. I mean, I had a second kidney biopsy, and that was optional.
Right.
Not the most comfortable thing in the world to have done. And it's probably the worst part of the test, but it gave a lot of information. So sort of an 8 hours of discomfort for myself has given us a lot of information that we needed and has been really helpful. So a little bit of discomfort. I could have said no, but to be fair, it was worthwhile. It's worth doing.
So you were made to feel you weren't put under any pressure to have that second biopsy.
Not even close to being. No. It was completely my decision on whether I wanted to or not. It wasn't a spur of the moment. We need a decision now. I could think about it and actually weigh up in my own mind and with my own family the pros and cons of having it done. And I said yes, and we did it. But it was entirely down to me, and it was my choice, and it was a free choice.
Because I think that's quite important, isn't it, for Dipper, that if you come into this clinical trial, that at any point that somebody says, oh, I don't want to, if somebody asks you to do something and you feel at all unsure about it, one, you're allowed to ask to find out more details, and the other is you're allowed to say no.
Absolutely.
Unconditionally.
Absolutely. And I think before any trial, the information that they give you a leaflet, they invite you to an information session. I think the process of being on to any trial, they give you everything that you need to know. And throughout that trial as well, if at any given time you're unsure or you forget the questions that you can ask, refer back to the information leaflets that you've been given, they're at hand, and it's a collaborative thing. I think the key word is collaborative. This is not just about the expectation is on us to support, or give them. You're not just a little muppet to the team. You're actually, it's a collaborative approach. They've given you all the information. You've taken on board that information, and you've gone in there willing, knowing the pros and cons, and I think that's what's important. And like I said to at any given time, you forget, you just ask the questions.
And that's important, isn't it? You don't have to remember everything at the first visit.
It's a lot of information. When you first get diagnosed with kidney chronic disease, it is overwhelming. Jason, we're all, that's the reason everybody's on this call. It is overwhelming. And throughout that journey, your bloods differ, your body differs, and you're forever adapting to that constant need. So when asked to do a trial on your free will, it can be overwhelming, and if you're able to, I'd say go for it, because you've got nothing to lose, because all you're doing in most of these trials is giving blood, and you're already giving bloods to give your kidney functionality anyway. So support the community, support everybody else, and support, the future people who could suffer as well. And that's why I did it, because, it's not just about what I know, it's about what everybody else know as well.
Right. And so Jason, so Dipper was saying that she was giving blood. You were giving blood and renal biopsy. Was there anything else that you give? Because I know the study that TK spoke about before, about probiotic study, I don't know if it's a definite, because I work in the lab, so I do the analysis of the samples, but it could be that you have to give a fecal sample. And would people be, so what do you give, Jason?
I have to do a 24-hour urine sample.
Right.
That can be fun at times when you're out and about carrying your bag with you. You get a lot of strange questions, but yeah, and that's sort of along with the bloods. It is a lot of blood at times, or it appears to be. But other than that, and the renal biopsy, they're the only samples I've given.
Right.
Okay. But yeah, it's as I say, it's part of the routine now. Every 12 weeks, everything's ready to go, and it's part of the routine of what you do. It's your everyday life now.
So do you, going back to the 24-hour urine sample, I've done one as a healthy control because I've not got renal disease. And I remember going to a wedding. That's tricky.
Very tricky. Yeah.
Container. Anyway, where was it? Where was it going? Oh, yeah. So have you been told at the end of your study whether you'll be told whether you've been on the treatment or the comparator? Jason,
the question, I believe Chike's asked the question already, because we're part of the trial.
Right.
If we can continue with the treatment.
Right.
I believe we're still waiting on answers for that.
Right. Okay.
But yeah, I mean, personally, because the treatment's been so effective, it's the one thing I would like to stay on it, rather than then having to move on to something different. Because the biggest thing for me, and it is quite a big thing, this new drug, this drug we take, there's no side effects, or I've had no side effects.
Oh, right. So yeah, that's really important for people to know, isn't it? Really?
It's a massive one. The side effects that come with it are very, very, very minimal. Right. It's literally a negligible thing. I'm aware that sort of conventional drugs, if you like, and the stuff that we would be on, there can be some quite dramatic side effects from that. So yeah, for me personally, I'm hoping that towards the end of the trial we find out that we can carry on and we'll actually be supplied with it.
Right. Okay. Yeah. And you will find out whether you were on the placebo, or you think you're on the treatment, but
we are on treatment. The trial I'm on, it's open treatment, so there's no placebo.
Right.
We are on the treatment.
Oh, right, and you're happy with the treatment?
Yeah, very much so.
That's really good. That's really good news.
Yeah, I take one tablet each morning. That's it, done.
Right. To add to the other tablets that you take anyway.
I take nothing. I take no other tablets.
Wow, lucky you.
I'll be truthful. I absolutely detest tablets and medication.
Right.
I've never been one really for taking them.
Well, that's interesting. And you're still prepared to do on a clinical trial. Well, that's very good.
Yes.
That's really commendable.
Yes. So I take one tablet. That's it. And the hardest part at the beginning was remembering to take it.
Right.
Because unless you take medication regular, it's very, very easy to forget. So that was the hardest part, is remembering, but I've got sort of a pill bottle now. Right. So yeah, you just pop one tablet, that's it, job done.
Okay. So have you had any side effects, Dipper?
No, I think the only thing that I had originally is basically because it's taking nasal spray. Yeah. It was just literally, for the first sort of 4 weeks, I was sort of, very itchy nose and, sort of slightly out of breath. But now it's, just when you take it, you just sneeze a couple of times and carry on as per normal. Yeah, absolutely.
Great. Okay. So I've just had a look to see if are there any questions here. There are quite on the chat. People are very pleased that you are providing this information because without you two joining this, we wouldn't know what it was like to be on a clinical trial. So people are very pleased about that.
You're welcome.
Right. So one of the questions that one of the clinicians would have to answer, so they're not for you could, I think they're not directed at you, but I think people are very pleased that you have been Is there anything else that you think will be important for people to know about before they embarked on a clinical trial, or if they were thinking about going on a clinical trial?
I think from me, just have an open mind, just go with it, and just trust the relationship that you have with the nurses and the doctors, because you're doing it for a good cause.
Yeah,
that's the only thing that I would say.
So go on. Sorry, Jason. Sorry.
Yeah, I couldn't agree more. That have an open mind, build that relationship with the nurses and the consultants, etc.
Yeah.
And yeah, just think about what it is that you're actually doing for other people, not just yourself, but for other people and for those in your situation.